Hi, my name is Therese Darcy. I'm a Master's of Nursing Education student at the University of Hartford, and today I am presenting the First Step Act of 2018. So, the First Step Act was introduced into the Senate by Senator Chuck Grassley, a Republican from Iowa, and Senator Dick Dubin, a Democrat from Illinois. And this was formerly known as the Sentencing and Reform Corrections Act, or the SRCA. The SRCA was kind of like the building block of the First Step Act. So the advocates of prison reform and the legislators came together, and the First Step Act was kind of like their compromise from the SRCA. So it was a very big deal. In my presentation today, I'd like to first go over an overview of the First Step Act, history of the legislation, including the authors, financial considerations of the First Step Act, why the First Step Act is important to healthcare, implications for nursing and community healthcare initiatives, summary, and then a list of my references. The First Step Act stands for the Formerly Incarcerated Reenter Society, Transform Safely Transitioning Every Person Act. The First Step Act is a bipartisan bill that aims to provide prison reform in all of the United States to reduce recidivism back into the prison systems. The FSA has many things it does relating to healthcare, including medication-assisted treatment for opiate addiction, sanitary hygiene products to all inmates within the prison system, compassionate release programs, and restrictions on juvenile solitary confinement. They also aim to prevent shackling of any pregnant or laboring inmate. The First Step Act was introduced into Senate under Act S 756 on 3/29/17, then underwent committee consideration by Senate Committees on Commerce, Science, and Transportation, and House Committee on Transportation and Infrastructure. It passed the Senate on August 3rd, 2017. It passed the House of Representatives on July 25th, 2018, with amendments. Senate agreed to the House amendments on December 18th, 2018, with further amendments. House of Representatives agreed to Senate amendment on December 20th, 2018, and then Donald Trump passed into law on December 21st, 2018, making the First Step Act a law. Fun fact I wanted to mention was that I feel like this law wouldn't have been enacted if it weren't for some celebrity endorsements like Kim Kardashian, Kanye West, and Van Jones, who all heavily lobbied Donald Trump to get this bill passed into law. Another important aspect of the First Step Act to healthcare is the restrictions on solitary confinement among juveniles in correctional facilities. Under the First Step Act, it is now unlawful to use solitary confinement for youth in any federal facility. According to one study in New York City by the Bureau of Correctional Health Services of the New York City Department of Health and Mental Hygiene, it found that solitary confinement was strongly associated with acts of self-harm. Inmates in solitary confinement were almost 7 times more likely to commit acts of self-harm. The majority of those who perform acts of self-harm were inmates under 18 years old. Under the First Step Act, prisoners who are deemed terminal will have the right to have their attorneys and loved ones notified of their condition within 72 hours of a diagnosis. The prisoner's representation, whether it be an attorney or family, may prepare to request for a sentence reduction. Most states have provisions for compassionate release, but its use varies greatly among jurisdictions. One barrier to the use of compassionate release is the difficult nature of the process of having an inmate sentence reduced, resulting in early release. It's a cumbersome process, and the bureaucratic complexities in the decision to release are frequently a barrier to its use. One of the biggest impacts on healthcare, I believe the first step to have, is medication-assisted treatments, especially when they are used in the prison system. Medication-assisted treatments are a pharmacological intervention in which methadone, Suboxone, or Subutex are used to combat the cravings and withdrawal symptoms associated with opiate addiction. 80 to 85% of the prison population, especially here in Connecticut, have some type of substance abuse issues. This is an evidence-based, has lots of research about how effective MATs are when treating opiate addiction in combination with other types of therapy, traditional addiction therapy. MATs are grossly underutilized in the United States and especially in the prison systems. Despite significant evidence of its success, it has been shown to decrease drug and alcohol abuse, criminal activity and arrest, retention and treatment, preventing overdose, and HIV risk behavior. Methadone has shown to be the most prevalent in the prison systems because its ability to be used at ease with a low healthcare cost, and it's able to be used in pregnant women as well. Connecticut prison systems have initiated a statewide policy to ensure all people that enter the prison system on methadone are able to stay on methadone while they're in prison because of the opioid epidemic that's going on primarily in the East Coast of the United States. There are 15,400 prisoners in Connecticut prisons right now, with 80 to 85% of this number suffering from substance abuse disorder, and the FSA aims to really promote recovery among this population. So I think this has a significant impact on healthcare and reducing the recidivism rates among prisons here. Dignity for women is a key aspect in the First Step Act, and one that is near and dear to my heart as I work in maternity and deal with a lot of prison women population. The first thing I'd like to discuss is family visitation rights. 18 to 20% of incarcerated women have children under the age of 18. Children who grow up with parents who are incarcerated are 6 to 7 times more likely to be incarcerated themselves. Also, prisoners who are allowed family visits while they're incarcerated have better post-release outcomes and decreased recidivism rates. The next thing I'd like to talk about is care for female prisoners during pregnancy and childbirth. This is key to promoting the health and well-being of the fetus that lives inside of this prisoner. A big important aspect of the First Step Act is preventing the use of shackles during labor, delivery, and the initial postpartum period, which I feel like is very important. It's very difficult to labor with a patient who is chained to a bed, and it's just, it's terrible to me. I mean, talk about a lack of dignity. I hate it. I hate it. So I'm glad that is part of this. Another aspect of pregnant women is making sure that these women are getting their prenatal care, getting their nutritional supplements, eating healthier meals. So that is also a part of it. And postpartum recovery. So women aren't supposed to be shackled during their postpartum recovery either. and that gives them time to bond with their baby. This is a very important aspect. So moms stay in hospital typically about 72 hours after birth, sometimes longer if they have a cesarean section. And this bonding time is essential for these moms. A lot of these patients aren't in prison for violent occurrences or anything, so I think this bonding period is crucial. So that's another important part. Feminine hygiene products. All women in the prison system are guaranteed to be provided with feminine hygiene products that are enough for their particular needs. So I think that's also a great one. Training is important. So first of all, think about training the staff, how to generally care for the pregnant woman, use of restraints, the impact of invasive searches on pregnant women, teaching staff about prenatal care, teaching moms about prenatal care, education programs for inmates, prenatal care, how to care for babies and toddlers, pregnancy-specific hygiene is another important one, parenting skills, general health of a child, and impacts of drug and alcohol abuse on their pregnancy and their baby.
Ready?
Ready.
I've given birth to 2 humans. I know the pain and the joy of childbirth. Every year, over 2,000 women in America give birth while in prison. I think to myself, what if I was in prison while pregnant? What if I was put in solitary confinement? What if I was not given the health care I needed? What if the male guards were allowed to watch me in the bathroom? What if I was moved to a prison hundreds of miles from my children, making it virtually impossible for them to visit? What if I had to choose between buying tampons or paying for the fees to call my child? What if I had to give birth while being shackled and chained to a bed? What if we decided as a society that this is not okay? What if we helped do something about it?
In summary, the First Step Act has many benefits to the healthcare system when it comes to prisoners in our federal and state penitentiaries across the United States. Fiscally, it is a big hit to the taxpayers, but any investment that we put into these prisoners now, and if we decrease the prison population, if recidivism rates go down, then the savings will be reinvested into these programs, and maybe we will not need further budget needs for these programs. And as far as reducing the opioid epidemic, the cost savings will be great in that arena as well. So I feel like this First Step Act is, in essence, just that, a first step. But I think it's really a great step in trying to reform the prison system, prevent criminalization of underprivileged minorities, and really, just trying to take a look at what is ours, what can we fix, and how can we reduce the cost of prisons and the early release programs and home confinement programs and re-entry reduction programs will eventually, if this act takes off, will reduce the cost to our national budget. So I think it should be taken into great consideration. Thank you.